Review terminologies related to ulcer. They are defined as well circumscribed, often depressed lesions covered by a fibrin clot causing yellow-white appearance, example aphthous ulcer. It is also described as breach in continuity of the surface of the epithelium of skin or mucous membrane to involve the underlying connective tissue as a result of micromolecular cell death of the surface epithelium or its traumatic removal. Classification of ulcers of oral cavity. Single acute ulcers like bite injury, thermal damage, chemical, toxic or drugs, mechanical irritation, radiation therapy. Acute multiple ulcers, hepatic gingivostomatitis, herpes zoster, varicella, herpangina, hand-foot-mouth disease, infectious mononucleosis, diphtheria, candidiosis, erythema multiforme, Ritter's syndrome, Stevens-Johnson syndrome, graft versus host disease, chemotherapy-induced plasma cell stomatitis. Single chronic ulcers, traumatic ulcer, CMV associated, tuberculous ulcer, syphilitic ulceration, necrotizing ciliometaplasia, fungal infections, sarcoidosis, Sweet syndrome. Chronic multiple ulcers, necrotizing ulcerative gingivitis, granulomatous with polyangiitis, bullous pemphigoid, mucous membrane pemphigoid, pemphigus vulgaris, lichen planus, linear IgA disease, Michelson-Rosenthal syndrome. Single recurrent ulcers, Behçet's disease, Crohn's disease, celiac disease. Recurrent multiple ulcers, recurrent hepatic stomatitis, pyoderma generosum, Sjogren's syndrome, systemic lupus erythematosus, PFA-APA syndrome, MAGIC syndrome, cyclic neutropenia, hyperimmunoglobulinemia D, oral hypersensitivity reaction.